Great. So hello, everyone. Thank you for joining us. We're going to just get started right now since we have a lot to cover in 45 minutes, and we want to make sure that we have enough time to cover a lot of questions at the end. My name is Mary Schaefer. I'm the Marketing and Communications Manager at Jericho Road Community Health Center. I'll be the one compiling your Q&A questions today and then bringing them to our two presenters after they finished with their prepared remarks. So if you want to submit a question, just use the chat. If you're on Zoom, you can use the drop-down menu where it probably says everyone right now. You can send your question privately to me if you want. You can use that drop-down menu to select Mary Schaefer, and then I'll be the only one to see it. Or you can send it just to the full chat if you don't mind everyone seeing your question. If you're joining us on Facebook Live, you don't really have that option, but you can submit questions in the comment section on Facebook. So let me quickly introduce our presenters, and then they'll just take it away. So first we have Dr. Allana Krolikowski. Dr. Krolikowski is our Chief Medical Officer and a family physician at Jericho Road. She received her medical degree from the University at Buffalo and completed her residency at Greater Lawrence Family Health Center in Lawrence, Massachusetts. She has also lived in and trained medical professionals in Malawi. Our other panelist is Takesha Leonard, a registered nurse, family nurse practitioner, and doctor of education. She received her medical education at both the University at Buffalo and DeUville College. Takesha is our East Side medical director and oversees our practice at Broadway. She also previously led our site at Genesee Street. Both Dr. Krolikowski and Takesha are heavily involved in direct patient care. Takesha has been consistently working in our COVID isolation unit at Broadway, testing and diagnosing hundreds of COVID cases throughout the pandemic, while Dr. Krolikowski has been actively caring for COVID patients in the hospital. So that's my intro, and I will now mute myself and turn it over to you two.
All right, thanks, Mary. So like Mary said, I'm Allana Krolikowski. I'm a family doctor and the Chief Medical Officer at Jericho Road Community Health Center. And today I'm going to share with you a little bit of information about what I know about vaccine development and our current COVID-19 vaccines that are available. We know that some people have hesitancy about these vaccines for a variety of reasons, and I'm hoping that today I can help educate you about what we know about the vaccines available so you can make the best decision for yourself, family, and others. We do know that over 75% of our United States population needs to take the vaccine, and that means both doses for us to reach a degree of normalcy sometime in 2021. So vaccine development involves many steps. Scientists research to find the technology that will work for that particular disease, and they do pre-human trials. Then they often wait months for approval to begin testing in humans. There are then 3 phases of human trials to test safety and effectiveness. The next step is waiting for FDA review and approval, followed by ACIP recommendations, which is an immunization organization, before we can begin widespread vaccination. Phase 4 is then post-approval monitoring and research for ongoing safety monitoring. In general, we know that vaccines are very safe. Most side effects occur within the first week, such as redness and pain at the site of injection or muscle aches and fever. Almost all side effects occur within the first 4 weeks. Delayed reactions, such as fever and rash, can appear 1 to 4 weeks after administration. And it is rare for side effects to occur beyond 8 weeks after vaccination. If you are someone who is concerned about vaccine safety, there are good resources on the World Health Organization and Center for Disease Control websites. So what about these COVID-19 vaccines? When COVID-19 emerged as a new virus with serious consequences, scientists all around the world started working on a vaccine as early as January of this year. There are many different technologies that can be used for vaccine development, but the 2 vaccines that have received FDA approval both use the same technology of messenger RNA or mRNA. These are the Pfizer-BioNTech vaccine and the Moderna vaccine. These will be the first mRNA vaccines approved for preventive use, but the mRNA technology is not new. It has been studied for decades for other purposes, such as immunotherapy for cancer. The way that these vaccines work is that they deliver a synthetic or man-made version of the mRNA used to create the coronavirus spike protein. This is going to be a little technical, but some of you may appreciate this. So You are not injected with live virus particles, so you cannot get COVID-19 from the vaccine. The mRNA genetic material enters your muscle cells at the injection site, but it is not able to enter the nucleus where your DNA is located. Therefore, it is not able to alter your DNA. Your cell's ribosomes then use the mRNA to create the spike protein, and afterward, the cell breaks down the instructions, or the mRNA, and gets rid of them. Your cell then puts the spike protein on its surface, and your body recognizes this as foreign and mounts an immune response. As a result, you create the antibodies and other immune functions necessary to fight COVID if you are exposed in the future. The mRNA vaccines came more quickly than other technologies because synthetic mRNA can be created in less than a week. Scientists have been studying this technology for years and had learned how to keep it stable, and production can be ramped up quickly and safely. mRNA technology has also been used in phase 1 trials for Zika virus, rabies, and influenza. It is important to note that the size of the phase 1, 2, and 3 trials for both the Pfizer and Moderna vaccines were similar to previous vaccine trials, other vaccines that have been approved and come to market. More than 20,000 people were injected with the Pfizer vaccine in the phase 3 trial, and more than 15,000 were injected with the Moderna vaccine in the phase 3 trial. And a comparable number of participants were injected with placebo. In both studies, the participants were monitored for at least 8 weeks. And as mentioned before, it is unusual for side effects to appear more than 8 weeks after vaccination. The Pfizer-BioNTech vaccine is given as 2 doses, 21 days apart, and it is 95% effective if you receive both doses. The most common side effects are injection site reactions, fatigue, headache, muscle pain, chills, joint pain, and fever. And these are signs that your body is building immunity. The Moderna vaccine is given as 2 doses, 28 days apart. So 21 days for Pfizer, 28 days for Moderna. And the 2-dose regimen is 94% effective. So they're very similar in effectiveness. The most common side effects are similar: injection site reactions, fatigue, headache, muscle pain, joint pain, and chills. When I finish, Takesha will share the racial data with you from these 2 vaccine trials. So far, these vaccines have been studied in adults only, age 16 and over for Pfizer and age 18 and over for Moderna. They have not been studied in pregnant women, breastfeeding women, or children. And those studies will likely start in January. As a family doctor with many years of experience, I see no reason why breastfeeding women should not get this vaccine. Breastfeeding women are able to get all vaccines, including ones that pregnant women cannot. They are a different group. For pregnant women, the Society of Maternal Fetal Medicine said that pregnant women should have been included in the trials since they are at higher risk of severe COVID infection, but they were not. The major national obstetrical organizations in the United States are recommending that pregnant women be allowed to get the vaccine if they choose to do so, even before trials are completed on pregnant women. We have seen that people with a history of severe allergies may be at higher risk of a severe allergy to this vaccine. In particular, if you have a history of anaphylaxis to vaccines or injectable therapies, you may want to wait to receive this vaccine. People with a history of anaphylaxis to food do not need to wait. If you have an immunocompromising condition, you can receive the vaccine unless vaccines are otherwise contraindicated for patients with your condition. I recommend you speak with your provider about your particular situation if you have severe allergies or an immunocompromising condition in order to weigh the risks and benefits. If you have a history of COVID-19, it is recommended that you receive the vaccine. There is no recommended minimum interval between the time you are infected and when you should get vaccinated, except we know you should not get it in the first 14 days after infection. But we do have increasing evidence that reinfection is unlikely in the first 90 days after infection. So you could wait until toward the end of this 90-day period to receive the vaccine. Ultimately, it is about a risk-benefit analysis. We know that the risks associated with COVID are much higher than the risks associated with the vaccine. Even if a rare side effect appears with one of the vaccines, it will still be so rare that your individual risk of dying from COVID or suffering long-term consequences will be higher. This is why we are strongly recommending the vaccination for all non-pregnant adults. Once the studies show that it is safe in pregnant women and children, we will recommend it for them as well. I hope this has been helpful. I'm going to turn it over now to Takesha Leonard, our Eastside Medical Director. Thank you.
Thank you, Allana, for the data and all the information. So I think for myself, I'm coming more from a perspective of seeing my patients in the rooms. I take care of a pretty large African-American, Latina, Bengali population, and just having one-on-one individual conversations where I have to say that the majority of my patients and even some of my staff are saying they will absolutely not get the vaccine. They will not get the vaccine. And then I think about being in isolation and seeing so many sick patients come in, seeing patients die from COVID, following up with patients in the hospital after they've been released and all of the potential side effects of COVID. And so I felt it was my duty as a practitioner, as a woman of color, as a practitioner at Jericho Road, to have this conference or to be on this town hall. So this is an opportunity for you guys to ask questions. Of course, for me, it's more directed towards my African-American population, as it's a large majority that are absolutely declining this vaccination. And so first I had to ask myself, like, what are the questions that I have and why am I getting it? But before I did that, I had to admit that there's a significant history of medical science in the African-American community that causes distrust. So it's not like, you know, their apprehension and their fear are just unfounded and are just coming from nowhere. I mean, it is documented history of experimental medical procedures on people of color. And so the fear is real, especially in my highest risk populations, which is my elderly adults over 65. They remember, they were there, they can tell you the stories, and they absolutely think that the push for the COVID vaccine towards the African-American and Latin communities are some sort of experimental or a trial on them. So when I'm talking to my patients, as I'm talking to you guys, I ask myself these questions. Who was in the room when these decisions were made? In every aspect of development of this vaccine, who was sitting around that table that represented me, that looked like me, that may have asked questions that were pertinent or relevant to my culture and my history? And what I found is that in every aspect of the development, the creation, the scientific research, the cohorts that met, the advisory committees, there were people of color, Asian, Latino, African-American people that were sitting around that table making these decisions. And there is a level of comfort in that someone that looks like me and can represent me well is sitting around that table saying, this is why I think this will be good for you. And that brings me some comfort. And this is what I tell my patients. Then my next question was, well, in the trials, how many African-American people, how many Asian people, how many Latin people were in the trials and in the data? Now, of course, the numbers are very disproportionate because of the lack of trust in the healthcare system for African-Americans. But there was 63% Caucasian, but they had over, I'm just gonna read this. So in the Moderna trial, there were 30% Black and Hispanic patients. About 6,000 participants were Hispanic, about 3,000 were African-American. And in Pfizer was pretty similar, about 36% Black and Hispanic. And then I looked at the side effects of getting the vaccine and seeing that, you know, they were mild and there were no deaths reported related to coronavirus from the vaccine. And then when I look at all that data and I can tell my patients that these are the reasons why I feel confident with not only telling you about that vaccine, but getting it myself and then reporting back to you and letting you know what I felt, what I was experiencing. There's a level of trust that's already been established between Jericho Road, myself and my patients. And so I think that the goal of this meeting is for you guys to ask questions, but to also encourage you guys who are on the fence or apprehensive to do research as I did. Before I made a decision to get the vaccine myself, I asked questions, I did research, I found out who was in the rooms, and then to make that decision. But this is what I do know, guys. You can absolutely die of COVID. You can die of COVID. I've seen it, I've witnessed it. It is horrible. And, you know, some people say, well, I'm young, I'm healthy, I eat well, I do well, I'm fine. but there are young, healthy patients and people that have done the exact same thing and have still succumbed to COVID. That is not a chance that I'm willing to take. That is not a chance that I will wish on any one of us to take. With my death, would leave behind 5 boys without a mom and over 3,000 patients that I've been caring for the last 10 years without a provider that they know loves and cares about them. And for me, that risk is too great with me not getting the COVID vaccine. And so that's where I'm going to conclude.
Okay, thank you both Dr. Krolikowski and Takesha for your presentations. I'm going to read some of the questions that we've received on Facebook and in the Zoom chat, and then you guys can decide who wants to answer those questions. So the first one is, if the vaccine is safe to take, why is there so much paperwork to fill out? The process should be easy, but instead it's being made difficult and makes it complicated for someone who doesn't know English to fill out the forms or download the mobile app.
Allana, I'm going to let you take that one because I've not seen the forms, unfortunately.
All right, I'm unmuted now. Sorry, I was muted. I couldn't talk. So the screening and consent form comes from the New York State Department of Health. I don't know that we're absolutely required to use it. And so if someone is struggling and can't fill it out, then we can ask them those questions when they come. They don't have to fill it out ahead of time. And then there was a second demographic form, but again, that's not required. And that information we have in our electronic record anyway, and can send if the state wants it. I think they are trying to keep track of who received the vaccine and have more sort of data about that. And then the mobile app is also not required, just encouraged. So I don't know if that answers that question. But.
Next question. And because I'm not a medical person, I hope you understand this question better than I do. Do you think it's a good idea to hold biologics prior to the vaccine?
That is a question I think you should ask your provider. I don't think that I would have my patient hold it, but yeah, I think you should talk to your provider. So.
Okay, next question. Sorry for all my clicking also to everyone who can hear me clicking away. What are the safety concerns for people with pre-existing medical conditions like type 2 diabetes, high cholesterol, and high blood pressure?
I can answer that, Allana. So doing the research in the vaccine trials, they had a large portion of patients with chronic medical conditions such as diabetes, hypertension, morbid obesity, and things like that, in order to show that the vaccine was effective with patients that were in that high risk category. And the side effects were equal to those who did not have any of those comorbidities. And I say that just to say the risk of getting COVID with those comorbidities can equal death, as opposed to the minor side effects that people experienced, but they were involved in the study and they did study those. And so I think that it was just as effective with very little side effects.
Is a vaccinated person able to carry the coronavirus to someone who's not vaccinated?
Yes, that is possible. So getting the vaccine will protect people from getting, it was designed to protect people from getting severe COVID, but it was not designed to protect you from being exposed. So it is possible to still be exposed to it, not have any symptoms. So basically be asymptomatic because your body already has antibodies from the vaccine, and then you can pass it to someone else. So that's why they are recommending that even if you get the vaccine, that you continue to wear your mask and distance and wash your hands. And once we get a good number of people vaccinated, Dr. Fauci had said over 75%, we really needed vaccinated to return to something that looked more normal. So.
So we had a couple of people ask kind of about cost. Is the vaccine free? Will I have to pay for it? How much does it cost?
So the federal government has bought the vaccines, so patients will not be charged for the vaccine itself. Health facilities are allowed to charge an administration fee for the vaccine, which is usually less than $20 and usually paid by your insurance. But I would check with wherever you're planning to get the vaccine itself, find out what that sort of situation is. But we're not allowed to bill for the vaccine itself. We are allowed to bill an administration fee.
When will the vaccines be available to the wider community?
That's a good question. Takesha, you can hop into it. I don't have to just answer all of them. Sorry.
No, it's fine. So, they're getting the healthcare providers and the essential workers, and those in the higher risk categories done first. But when I was listening to Dr. Fauci, they were saying like maybe end of January, beginning of March. I think that was the projected timeline. It might be a little bit later than that, but I just know it's not going to be, maybe within the next 2 or 3 months where we can kind of offer it to the entire community.
Yeah, there's different phases. So right now we're in phase 1A, which is high risk healthcare workers and like nursing homes, and certain different states have made different designations of who fits in phase 1. Phase 1B will most likely be people 75 and older, and then other frontline workers. So like grocery store workers, restaurant workers, teachers. And then from there on. So I think it's going to be March, April before the general population can get it.
I think you kind of touched on this, but are kids able and allowed to take the vaccine?
16 and older.
16 and older for Pfizer, 18 and older for Moderna. So no children right now.
Is there a risk of an autoimmune reaction to mRNA immunizations? Are there concerns of free RNA in the tissues?
That's a good question. I don't think that is a real risk. Again, I think if you have an autoimmune condition, it's probably best to talk with your provider. But I think it's unlikely. There were mRNA studies for immunotherapy for cancer, and when they gave many doses of it, there were more severe reactions. But not in this two-dose vaccine series are you going to see anything like that.
Great segue to the next question, because that is, should everyone receive 2 doses? What happens if you don't get the second dose?
So everyone should receive the 2 doses because that's what guarantees it the 95% effectiveness. And so, it would be less effective, and therefore, you're more at risk for transmission and things like that. So you should definitely get the 2 doses. That's the most effective way to keep us safe.
Do we anticipate that we will need to get like a booster or a new vaccination every year like we get with the flu shot?
I don't think that we know enough yet. I don't think we know enough yet. And I think actually a patient today asked me about the variant that they've found in the United Kingdom, and if that will affect the effectiveness of the vaccine. What I've been seeing from experts is that they think that it would take at least 2 to 3 years to develop enough mutations. I mean, it's normal for coronavirus. Like there's more, like we know COVID-19, but there's many coronaviruses. So it's normal for the coronavirus species or whatever to develop mutations. That's just how microbiology, what happens with viruses and bacteria, they develop mutations, and then some of them stick and some don't. But they think it'll probably take 2 to 3 years before there would be enough mutations that the vaccine didn't work anymore. So I think that's still yet to be seen, but it could be that you'd need a booster after so many years, but probably not within 1 year, I don't think. So.
how will people be notified when they are eligible to receive the vaccine? Who will be notifying patients or the wider community?
So I think at Jericho Road, we're vaccinating our patients, so we haven't really discussed how that was going to work yet. And I haven't heard any word. I don't know if you have, Allana, about how they're going to notify the wider community. But what I will say is that Jericho Road has always been an advocate and stood in the front lines during this whole coronavirus pandemic. And so, our concern for our communities getting vaccinated is very real. And so as soon as we have any information, we will publish it. We will let you guys know. And we will also advocate to make sure that the vaccine is widely disseminated and that everyone has an opportunity to get that. So.
Yeah, we do. So here at Jericho Road, we do have a COVID vaccine task force to roll this out. The information is ever changing as to what's happening. We know that the county is planning to have pods or points of distribution. There will be open pods that are open to the community and closed pods. Closed pods, like, so Jericho will be a closed pod where it's open to staff, patients, and their families. But, that being said, like the New York State Department of Health told us on Friday afternoon that we received Moderna vaccines yesterday, and that we are, those are for vaccinating high-risk healthcare workers or our staff, and that we received extra vaccines to vaccinate people who are in their phase 1A, specifically residents and staff of congregate living facilities that are under OMH, OASIS, and OPWDD. So we were notified of that on Friday afternoon, that's a population or set of populations we'll be vaccinating in the coming weeks. And so we will receive notice from Department of Health as time goes on of who we are allowed to vaccinate. And then we will do our best to get the word out. This morning on our meeting, I asked that once we are allowed to vaccinate 75 and older, that we have a report created that we can then call those patients. But we don't know necessarily all of our patients who are frontline workers, in their jobs. So they'll have to call us when they, we can notify in general, but they'll also have to call us and get scheduled. So.
Probably last two questions here. Since Dr. Krolikowski and Takesha do have to see patients today, and we're seeing patients before this. So you did kind of touch on this, but I think probably just some more clarity, I guess. If I can carry the COVID virus after I'm vaccinated, is my family safe? Could I be contagious to my family?
Yes. Yes. So Dr. Allana did mention that there's still a risk of transmission, which is why we are, recommending that anyone who can get vaccinated, because that's the only way we're going to form that herd community and get to some sort of normalcy where transmission rate is like super low. But yes, you're still at risk. That's why you still want to use all the precautions and, social distancing, mask, keep your gatherings small, wash your hands. So yes, the answer is yes.
Okay, and then this will be the last. How long after you get the vaccine, probably, I guess, both doses, how long after that are you considered immune? How long does it take for your body to build up its immunity?
So it can be up to a couple weeks after your second dose.
Great. Okay, so that's all the questions. And we are ending pretty much right on time. Thank you so much to Dr. Krolikowski and Takesha. Do either of you have any last things that you would like to say, or are we all set?
So I thank you guys for, joining us here again. At Jericho Road, we are strongly recommending the COVID vaccination, but we also, want to keep it open for you guys to send emails or ask questions. And we'll give you and provide you with all the information that we know. Again, this is still a new thing that's developing and changing all the time. So no, we do not have all the answers. But we as a team believe that the vaccination is the closest thing we're going to have to keep us safe, keep us alive, and to return to some sort of normal function in the society. So I thank you all for joining us.
Yeah, well said. Thank you, Takesha.
So thank you to everyone for attending and joining. A recording of this video will be available on Facebook literally right after we end the transmission here. And we will also be uploading it later to our YouTube channel. So if you found this useful and you think other people should see it, feel free to share or go back and rewatch if you need to. And that's it. Have a great day, everybody. Thank you so much.
Thank you. Bye, everyone.
Bye.